Hello everyone, my name is Lupita Gonzalez and today I'm going to be discussing about these important people called interpreters. Okay, so I want everyone to take a second and imagine themselves as being in need of immediate health care or having a loved one in the hospital. But the thing is, you aren't able to understand or communicate with the healthcare provider surrounding you because you don't speak English. Could you imagine that gut feeling of anxiety of not knowing what's going on around you? Well, that's the case for millions of non-English speaking people in the United States. For most of us, this isn't something we worry about, but it's a topic that should be discussed more often. Interpreters are often overlooked or seen as just another part of the healthcare world, but for some, they are the saving grace to be able to communicate with patients. What many people don't realize is how important and crucial they are for people to receive the best patient care as possible. I have personally experienced being an interpreter for my own loved ones, and I'm sure many of you have your own experiences as well. I also got to volunteer at my local cancer center, and I was able to interpret for patients who didn't speak English. I also got to see how much of a need there is for interpreters and how much they lack in the healthcare world. For the next 5 minutes, I'd like to share 3 important points that I found doing my research. My research first begins with what is a translator and what strategies do they use to translate. So what exactly is a translator, you may ask? Well, a translator is a certified person who is trained to translate from one language into another. In an article titled Agents of Empathy of How Medical Interpreters Bridge Socio-Cultural Gaps in Genomic Sequencing Disclosures with Spanish-Speaking Families by author Amanda Gutierrez in 2019, in her article, I found an important quote that stuck out to me that stated, "They use 5 linguistic tools: contextualization, encouragement, checking comprehension, endearment, and softening. They refer to these tools as empathetic. This method allows for better understanding of the patient's needs and allows there to be an interpersonal relationship." This other example caught my eye as well. In an academic journal by Fatmet Gandhi titled Nurses' Empathy in the Different Wards Cross-Sectional Study in 2020, he goes in depth and states that communication is a vital element in the nursing practice because they spend most of their time with patients compared to other members of the healthcare team. In healthcare, patients are supposed to be treated equally and given the proper care. So in this case, if there is no interpreter, how is a patient supposed to communicate with the physician? Being denied the ability to communicate is not a way of being treated equally. It's persecution. The second topic I'm going to discuss is what are the benefits of knowing how to translate. In an article titled With Scarce Access to Interpreters, Immigrants Struggle to Understand Doctors' Orders by Sheila Mulrooney in 2018. This article was really interesting to me because it gave a real-life example of an effect of not having a translator. Mulrooney states that in one case, a 9-year-old Vietnamese girl was rushed to the emergency room with the appearance of having a bad case of the stomach flu. Her parents spoke no English and there were no on-staff interpreters at the time. The doctor prescribed medication that's not usually recommended for children. The family was sent home with written instructions in English. English, a language they can't understand. The instructions the doctor gave her stated that if she had any symptoms to return to the hospital. The girl had an advised reaction and suffered a heart attack and died. So the benefit of being a translator in this case is saving a life. Going back to what I previously talked about in the beginning with my experience at the cancer center, one experience that I'll never forget would be when I translated for a Hispanic male about his symptoms while he was going through chemotherapy. I quickly had to adapt and the wheels of my brain started turning as I translated Spanish symptoms into English so the nurse could understand. I could tell by just looking in their eyes how grateful they were that I was there to help. If it wasn't for me, I have no clue how that patient would have communicated his symptoms because they didn't have access to interpreters on hand. Being able to help people gives you a sense of fulfillment and warms your heart. The last topic I'm going to discuss is why there is a big need for translators in the healthcare field. I also found that the American Hospital Association in 2016 surveyed 4,586 hospitals, and that survey suggested that only 56% offered some sort of linguistic and translation services. 56% isn't enough. I don't understand why the numbers aren't higher or why these services aren't provided. The last piece of evidence I found was an article titled "Hospitals Have Left Many COVID-19 Patients Who Don't Speak English Alone, Confused, and Without Proper Care." In 2020, Joshua Kaplan interviewed a medical healthcare worker who said it takes 10 minutes of sitting on a phone to reach an interpreter. Valuable time that could be used to provide patient care is wasted while trying to reach an interpreter. Every hospital should have access to these kinds of resources. All in all, interpreters are underrated and aren't given enough credit for what they do on a daily basis. First, I informed you on what exactly an interpreter was and the strategies they use to translate a language. Second, I expressed the benefits of knowing how to translate. Last but not least, I showed you the statistics of why there is a need for translators in the healthcare field. I hope everyone enjoyed my speech and learned something new today. I hope everyone has a great day.